You will not be able to stay home.
We are back, and we've got two people from the Harm Reduction Coalition in the virtual house, Danny Drysdale and Denise Ellerick. I would like to use this time to let my two guests tell the story of the Harm Reduction Coalition. Denise Ellerick is a healthcare professional educated during the AIDS crisis in the 1980s. She is a community activist and has volunteered with the Santa Cruz AIDS Project, SAFE RX, and Community Prevention Partners. In 2018, she founded the Harm Reduction Coalition of Santa Cruz County to build a network of support and advocacy for permanent, sustainable harm reduction. Welcome, Denise Ellerick.
Hey, welcome. Thank you.
Glad to have you. Danny Drysdale is on staff with the Harm Reduction Coalition of Santa Cruz County as their Syringe Services Program Coordinator. She grew up in Aptos and lives in Santa Cruz and had been involved in various community organizing projects and progressive electoral campaigns before settling her focus mostly on the Harm Reduction Coalition of Santa Cruz County in 2018. Welcome, Danny Drysdale.
Hi, Chris. Thanks for having us.
I wanted to kick it off with you, Denise Ellerick. If you could just, and full disclosure, Denise Ellerick has been my family's dental hygienist for the last 10 years. I just want to say that, full disclosure. Could you start by sharing with us what the Harm Reduction Coalition is and how it came about?
Well, we came about 3 years ago in 2018 in response to some outcry in the community. Myself and a nurse activated the National Harm Reduction Coalition to come to Santa Cruz and have a listening session where we invited about over 70 people, crammed themselves into the downtown library meeting room to really dig deep into Santa Cruz's history around harm reduction, where we are, where we need to go during an opioid use crisis and homelessness crisis. And then from there, a coalition was born. We had representatives from the county there, Dr. Leff, who was our health officer at the time. At the time, we just wanted to do everything we could do to support his advocacy and work at the board level. And I had already been doing some outreach to distribute naloxone, which is the opioid reversal drug, and kind of talking to people that use drugs down at various encampments. And they were asking for support and mobile outreach. And so that's kind of where we were born in the Public Health Week of 2018.
I'm going to come back to you about some of the pushback that your organization has had, but I want to go to Danny Drysdale. And full disclosure here, too. I met Danny on a Bernie Sanders campaign in 2016, and she was an ardent organizer, good campaigner, and I am not surprised, given her skills and previous experience, that Harm Reduction Coalition has been so successful in Santa Cruz County. Danny, how did you get involved?
Well, thank you for the kind words, Chris. Yeah, how did I get involved? Let's see. A good friend of mine introduced me to Denise towards the end of 2018. So when Denise had been doing it for several months then already, I had been involved in some local elections here, tenant organizing, and some student organizing projects. But I grew up in Aptos, and I grew up, from a very young age using a lot of drugs and having just a really hard time with it in my teenage years, and always wanted to do work around it, but had been told by, been told by a lot of folks in the community that it's a really hard thing to organize around here, and it's really dangerous, and the meanies will come after you. So, maybe wait a few years until you've been organizing for longer to stick your hands into that mess. But then I met Denise and came out one night to see the work that she was doing with a dear friend of mine. And, Denise was so welcoming, and I just saw what she's doing. It's actually very straightforward and very beautiful. And afterwards, me and my friend cried and talked about how wonderful the work was. And I was just hooked from that point on. And have made it like my home in so many ways ever since then.
Denise Ellerick, I want to go back to the Barson Street days and the pushback that you received from Take Back Santa Cruz. Can you talk a little bit about that And what is Take Back, and why are they don't like the harm reduction program?
That's a tough one to unpack. So I wasn't paying attention. I always knew we had historical, incredibly internationally renowned syringe access and disposal. Thank you to Marty Wormhout and
former
John
supervisor,
Laird
county supervisor, one of my mentors.
and Mayor. Yeah, I mean, so we went way back, and I wasn't really paying close attention because I had other things going on in my life with little kids and a sick family member. And I kept waiting for the community to kind of get a clue, like, okay, that's going to get tamped down. We need, I was waiting for all of our electeds to stand up and rally and say, no, 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 hands off this very important program. And for the most part, that really didn't happen. So I was a little late to organize, and better late than never. But I don't really know who or what Take Back is. I mean, it's just a mystery to me. But I just don't turn to social media groups for public health policy.
Well, let's fast forward then, and you scored a huge grant to help in the syringe distribution and recovery program here in Santa Cruz, and that has not been without further, pushback. Could you talk a little bit about that and about the grant itself, and then the lawsuit?
Yeah, well, about 3 years ago, there was some advocacy work being done up in the state when we could travel and meet people, because the program statewide said, basically one thing: we need staffing, we need budget. So the Drug Policy Alliance and people from HEPAC up in the Alameda County, we met with a lot of representatives at the state level, and to really lobby for permanent, sustainable funding for all the syringe programs in California. Now there's 62. So through a grant process, the Senate passed it, and it's $15 million a year for, I think, 3 years. And so 62 programs can apply for a piece of that each year. And so we got a 3-year funding, like a lot of other programs did, to cover staffing and programmatic costs. And that was a huge win. We're here, we're out, we're proud, we're long-term, we're not going anywhere. And there's a lot of misinformation being moved around in various circles about that grant funding, but we're excited. We're happy about it.
Danny Drysdale of the Harm Reduction Coalition. What do you say when people say Santa Cruz has a drug problem? Do we?
I mean, I think that's a framing that you hear a lot. I think I as somebody who started using drugs when I was 13, I think there's a huge amount of drug use here, and I didn't realize that that's not normal everywhere till I started traveling towards the end of my teenage years and telling people about my life in the last 5 years or so, and they were like kind of taken aback by it. And so, I mean, I think there really is a high prevalence of drug use here. There is definitely a high prevalence of drug use in the young population here. But with Santa Cruz, I mean, it has a lot of crises. And I think, just as a housing crisis, a crisis of people just having one of the most their basic needs being very unstable. And I think Santa Cruz is a very nice place to be. And a lot of people who were born here don't want to be pushed out. I know a lot of my friends that were born here were pushed out by the prices, but if you're born into this place, a lot of folks they want to stay here, and even if you end up struggling a lot with drugs or struggling to maintain housing, like you kind of want to hang on to that. And I think a lot of that can feed into why we see a lot of folks that still live here. We're still using a lot, and I don't know. People have asked me before, why does Santa Cruz seem to have these higher rates of opioid use and stimulant use and stuff? And I just don't know enough about the political economy of that to say for sure why that is. But I mean, I think it's definitely related to the degree of the housing crisis we have, and it's definitely related to the global crisis around drug use and around the lack of services for people that use drugs and stuff like that.
Is it fair to me to ask you if you are drug-free right now?
I mean, you could ask, but I'm not. I'm a person who uses drugs to this day. There's people that are very, very dear to me that practice abstinence, that are part of 12-step programs and hold the program very dear to their heart. And that's just never the thing that works for me. A paradigm of managed use and, changing my relationship to use is what works for me and what keeps me healthy. But my relationship to drugs is very different from when I was, an 18-year-old kid just struggling to go to college and dropping out over and over again. So I'm in a different place than I was then. But yeah, I still use drugs.
Thank you for that honest answer. Denise Ellerick of the Harm Reduction Coalition, I'm not going to let you off the hook. Who is suing you for the good work you're doing? Why do they want to stop it?
Well, I can tell you who the legal team is. The legal team is a very right-wing attorney from Nevada City. His name is Walt McNeil, and he's got a little cottage industry carved out for himself. Now, he was very successful in the Chico area. And then former Mayor Terrazas partnered
David
with
Terrazas.
Yes, David Terrazas partnered with Walt McNeil and his attorneys in his firm, Gabrielle Corte from the Needle Solution team, or the Not So Solutions team, and two of his other attorneys in the firm. And then the plaintiffs are none other than the guy that lost the AR-15, Kevin Vogel, former.
We're just segueing from that show into this show.
Yes, the guy that invited ICE to the community, lost an AR-15. Somehow they managed to murder a man with a rake. But yeah, he's suing us. He's a plaintiff. So is current council member Renee Golder, Melissa Freebairn, a person named Johnny Font who went to high school with my husband, and the Grant Park Street neighborhood cluster of people
Association Advocates
together.
Wow.
Have a couple extra on the end there.
What an interesting group. I see that Walt McNeil is actually the elected sheriff of Leon County in Nevada. He was elected in 2016, according to the internet, which is from the Leon County website.
I think that's a different guy.
You do? You think is that a different guy? Walt McNeil?
I think so.
Okay, then
Yes, that's a different man.
I take it all back then.
I'm looking at him right now.
So,
He's very right wing. He's very Trumpian.
I see one of the charts that you sent me that opioid use peaked a while back, but then in came the synthetic opioids. And could you talk a little bit about that? Either Danny Drysdale or Denise Ellerick from the Harm Reduction Coalition?
Danny, do you want to go ahead and take that one on?
Yeah, I can start, and then you can add anything on this. I mean, so to be clear, synthetic opioids have been around for a long time now. That just refers to some pretty popular drugs like OxyContin and Vicodin and stuff that, 10 years ago and more were prescribed much, much, much more heavily than they are now. And, in some places are still prescribed very, very heavily. Those are all synthetic opioids, but I think what you're probably referring to is fentanyl, a specific opioid used a lot in hospital settings. If you ever put under anesthesia, frequently fentanyl is used for that. That's become more prevalent on the street as a street drug, and it's been something that's been a lot more prevalent is not people saying, I'm selling fentanyl. Here's some fentanyl to buy. You know that you're getting this drug, but people selling heroin and even other drugs that have some fentanyl in it. And in many cases, it's mixed in a way that is not where the dosage is, dose to dose. It's not even. It's not evenly mixed. And fentanyl is a very potent substance just by weight compared to heroin or meth. And so you end up with these. You can end up with a little baggie of drugs that just has a really dangerous amount of fentanyl in it. And if folks aren't expecting that, that can lead to overdoses, especially fatal ones. And that's something like right now in the SF Bay Area, it's really, really spiking. I would say in Santa Cruz, while we are seeing more fentanyl, I know our wonderful coroner, Stephanie, Denise will have to remind me of her last name, and I'm sorry for forgetting.
Stephanie Fiore.
Yeah, she's really on top of it, and is all, they do toxicology screens on everyone that dies of an overdose, and they look for the presence of fentanyl, and so she's really tracking the trends. I could speak to it better, but it's definitely more and more of a thing, and even being put into non-opioids, like I said, like meth. I know when I was 17 or 18 and still using a lot of drugs, there was a thing where there was Xanax pills going around the Bay Area, and then here that had fentanyl in them. And some pretty prominent young people died during that time here from that. And so, it can be a pretty dangerous thing. But again, like, I think a lot of the dangers of drug use aren't from like, oh, there's this new scary super drug out there that's what's killing everyone. What's killing people is a lack of adequate housing, a lack of adequate services, the inability for us to set up things like safe consumption sites.
Could you get closer? Could you get closer to your phone, because your voice just suddenly dropped, Danny?
Oh yeah, how does it sound right now?
Sound perfect.
Okay, yeah, I don't know. I'm on AirPods. Yeah, I was just saying that I think, I think a lot of times, especially police departments and stuff, will focus on fentanyl as this scary new super drug that's causing all the problems, but the problems are structural. The problems come from capitalism and structural racism, and the symptoms that are driven by those structural forces, like lack of housing, lack of adequate services, those are what's really killing people in the end. And the lack of a safe drug supply, right? Like, the reason people are buying drugs with fentanyl mixed in is because the drug market is completely unregulated, and because it is completely criminalized. And the more that we criminalize it, the more dangerous the drug supply gets.
That's interesting. You went from the macro to the micro, but take us a little more into the micro, from the capitalist issues to what you do every day in your work in the harm reduction program. Take us through a couple hours or something. Fast forward through that.
Sure. Yeah, I can run you through, like, what it looks like to do a bit of outreach or something like that. I think, we during COVID, things have changed a bit, but we try and run I think if anything, it's tighter now. We try and run a very tight ship. To follow all COVID protocols and keep everybody safe. But generally, folks will come to our site. They will show up. A lot of them know the drill. Some people, it's their first time. Denise, a lot of times, is filling the role of getting in and greeting people and getting into deeper conversation with them. A lot of times I fill a role of taking people's orders, trying to understand their needs. And then we have a team of volunteers that are filling orders and doing like a no contact handoff.
What are their needs and what orders do you fill?
Yeah, so I think the really important stuff here, naloxone is a really big thing that we distribute. That is the opioid overdose reversal agent. So that is we mostly hand it out in a nasal spray. It's something that you can stick up somebody's nose and spray in there, and it will reverse an opioid overdose in a matter of seconds or minutes. Folks on the street use a lot of it. Folks who are using a lot of opioids, use that all the time, and they're really saving people's lives with that stuff all the time. So we're distributing a lot of that. We are providing clean syringes for people. We are collecting used syringes from people. We are handing out a lot of other supplies that go into safe injection. Disinfectant wipes is a big thing. Clean supplies to mix your drugs in, sterile water, stuff like that. And then a huge amount of wound care supplies. There's a lot of folks that come and see us that do not inject drugs or don't use drugs at all, but come to us for wound care supplies. And during COVID, of course, just like a ton of PPE. So we get a lot of free masks, free hand sanitizer, free gloves, stuff like that from the state. Somebody paid for it at some point, but like the level of the state, that gets sent to us, and SSPs have been a big frontline provider of that. So we do have a lot of folks that come to us just for that, or get that alongside with supplies for drug use. And then we talk to folks. Denise, I think, is especially talented at getting in deep with people about, just like, how's your week been? What's been going on? And we hear about police interactions. We hear about overdoses. We hear about struggles to navigate, the systems that are supposed to be housing people and stuff like that. We hear about social conflicts. And
thank you for that. I want to get into it a little bit with Denise Ellerick concerning a certain San Lorenzo park ground that I saw her at recently, the place where the encampment is in downtown Santa Cruz. Just before this show started, I came from a rally at City Hall, No on Tolo, No on the Outdoor Living Ordinance. this city council has wanted to move encampments around, which is basically against not only a judge's order. A judge had to come in and say, no, you can't do that. But the Center for Disease Control also says not a good idea to move large numbers of people around during an epidemic. Denise Ellerick of the Harm Reduction Coalition, could you talk a little bit about your work at the campground there that actually is a legal campground now, given the judge's order in Santa Cruz?
Right. Well, we know a lot of people that live there because they've been in 2 or 3 of the other large encampments that have been relocated. So typically a lot of what we do, and I go and walk through it at least twice a week, is mostly I'm doing syringe sweeps because as per our authorization, we are not allowed to conduct services or distribute syringes in city and county parks. So people know that, and we have a delivery line, so people might text or call us from anywhere in the county, and they will need a special arrangement made for us to deliver to them, which is something that was done for decades in Santa Cruz. The old Santa Cruz Needle Exchange program that became street outreach supporters, they always did mobile outreach. And I was talking to a volunteer with them just the other day, like, how did you do that before texting and before emails? And it must have been like, I feel like we have it so easy. So, and we're limited on the days that we can deliver, and that's Mondays, Wednesdays, and Fridays. But I'm pleased to see that the city has been has put up 2 new kiosks in really high need areas, and I go out sometimes with some of the nurses from HPHP. If they don't have another staff member that can go out, they need to go out in pairs. So I'll get a text if they're trying to locate some people to do some contact tracing or offering testing. They wanted to do random testing in several encampments just to try to get a sense of what the COVID clusters were located. So I'll go out with nurses and do some of that work and connect people to things that they need.
Okay, I got just 1 minute left, and I've got about 10 questions, but I'm going to end, I think, on giving each of you 30 seconds to say what, you're talking to somebody who's against your program, thinks it's the worst thing since sliced bread, and that, what are you doing? Crazy. You're handing out needles, etc. to, syringes to people who are drug users. Danny Drysdale of the Harm Reduction Coalition first. 30 seconds.
I just think that harm reduction is the only approach that is proven to work. Every single other approach to addressing drug use is based on fantasies and outright hatred in many cases. I think that harm reduction is really rooted in love and compassion for the individual drug user, but also on just like a ruthless pragmatism, understanding that like banging our heads up against the wall by throwing money into the police system is only going to hurt and kill people and isn't going to help
the war on drugs is a hoax. 20 seconds, Denise Ellerick, Harm Reduction Coalition.
Well, harm reduction is just acceptance in fact. Drug use is fact. It's not judged. It's not made right or wrong. And if it was your family member, would you want them sitting in a group of people sharing one syringe? And of course not. And just because we now have better treatments for hepatitis and for HIV doesn't mean we don't prevent it.
Okay, thank you. I hear my music coming on. Thank you, Danny Drysdale and Denise Ellerick from the Harm Reduction Coalition. Special thanks to Howard Feldstein for personing the soundboard tonight's show. And yes, we are going out on The Revolution Will Not Be Televised. It's up to you to get involved, and that's what this show's about. People do indeed make history, but often not under circumstances of their own choosing. Go out and make some history. This is Chris Crone for the Santa Cruz Political Report, which appears each week on Bratton Online. This has been Talk of the Bay. You can hear this show again if you go to our archives, KSQD.org, or tune in on Monday morning at 6 a.m. Thank you.
Agnew to eat hog maws confiscated from a Harlem sanctuary.